and girls, I'm so happy to be here with you all for Career Day. My name is Kraz Lynn, and I am a neonatal ICU nurse. And today I will be teaching you all about neonatal sepsis. That is a common disease that we find in the NICU. What is sepsis? Sepsis happens when your immune system has a really big reaction to an infection. When babies have an infection and sepsis happens, their body can have inflammation. And inflammation happens when your immune system is triggered and it sends out inflammatory cells. Inflammatory cells can either attack bacteria or they can heal damaged tissue. So, how a baby can get an infection is if there's bacteria in the birth canal, which is the journey a baby goes through in order to come into the real world, or the mom has an active infection that can increase their risk of getting infection going through the birth canal. They can get the bacteria inside of them if they breathe in or swallow any of the fluid in the birth canal. The second way that a baby can get bacteria inside of them is if someone comes and visits them and they have a cold or the flu and that gets onto the baby, which results in a sick baby at birth or within a few days. So, how do you know that a baby has an infection? You know that he or she has an infection if they have a fever, which means their head gets really hot, or they're easily irritated, or they're super sleepy all the time, or if they are having trouble eating. So if the infection gets even worse, the baby will have difficulty breathing, he or she will have a bluish ting around their mouth, and they'll have pale or gray skin, or they'll have a super high fever, or they'll have a high temperature all over their body, so it's like their entire body got a fever. Is sepsis curable? Well, if caught early, neonatal sepsis is curable through antibiotics and treatment, and the baby will grow up with no developmental problems or growth issues. Thank you all for having me today on Career Day. I love teaching you tiny humans about neonatal sepsis. Now, time for me to go off and save some babies.